The biggest cause of knee pain is not what you think. My name's Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Knee pain is a common condition. It affects millions of people, often due to everyday activities such as walking, running, climbing stairs. If you have knee pain, it's important to know when to see a doctor because there are many possible causes for knee pain, some more serious than others. The most common cause of knee pain is what's called patellofemoral pain syndrome. Unfortunately, it's also one of the most difficult to diagnose because there are many different factors that can contribute to patellofemoral pain. The patella or kneecap is supposed to glide smoothly in its groove on top of your femur, the thigh bone. If there's any friction between these two surfaces, it can cause irritation and discomfort in your knee. This condition is called patellofemoral syndrome. Basically, patella is the kneecap, femoral refers to the thigh bone, and syndrome means there's multiple symptoms present instead of just one specific problem. And that one problem that would cause pain and discomfort at any given time. Patellofemoral pain typically occurs during activities like running or going up and down stairs, which produces friction between the kneecap and thigh bone, causing inflammation around the front of the knee. The good news is there are a lot of things you can do to prevent or treat patellofemoral pain. Stretch before and after exercise, wear supportive shoes, strengthen the muscles around the knee and hip, even the core muscles, and ice when needed. Working with a physical therapist can help get rid of the pain as well. Surgery, fortunately, is rarely needed. All right, next, iliotibial band syndrome or IT band syndrome. This is a condition that occurs when the iliotibial band, a thick rubbery tendon that runs from your hip to your knee, becomes inflamed and irritated. The IT band is susceptible to friction from poor mechanics and overuse, which causes it to rub against the outside of your knee. This can cause pain and swelling in this area of your leg, as well as tenderness along what's called the lateral epicondyle, or the bony bump on the outside of the knee. The symptoms of IT band syndrome include pain on the outside of your knee during activity like running, difficulty walking upstairs, feeling like something's catching or snapping on the outside of your knee as you run, and swelling after exercise. Osteoarthritis. We talk about this a lot in these videos, but osteoarthritis is a common disease that causes pain and stiffness in your joints, like your knees. It's not just a problem, though, that affects the knees. It can affect other joints like your hips and fingers. Osteoarthritis happens when cartilage, or the cushioning tissue that covers all the bones, breaks down. Because osteoarthritis involves damage to joints, it often results in pain with movement. This can make it hard for someone that has arthritis to do things like walk around or bend down at work. Fortunately, there are steps people can take to manage symptoms associated with osteoarthritis so they don't interfere with daily living activities, and they can be better options than surgery or cortisone shots. And I've done a number of videos on other options. All right, patellar tendinopathy or jumper's knee. This is a condition that affects the tendon that attaches your kneecap to your shin bone. The pain from patellar tendinopathy can go from anywhere from mild to severe, and very, very often it gets worse with more activity. You may notice it hurts more when you squat or when you kneel. It may hurt more when you wear certain types of shoes. Often modifying physical activity and exercise can be helpful. Sometimes working with a physical therapist can be necessary. And on rare situations, injections or even surgery can be necessary, but usually don't do that unless the problem has gone on for a long time. Have your knee pain checked out by an orthopedic surgeon. If you have pain in your knees, see a doctor, get it checked out. Knee pain can be a sign of a serious problem that needs immediate treatment, such as an ACL injury or meniscus tear, which we'll talk about in future videos. If left untreated, the pain could get worse and lead to other knee problems later on. If you're not sure what's causing your knee discomfort, talk to your doctor, allow him or her to examine your knee. The doctor will probably perform x-rays of your knee, maybe even an MRI. Hopefully your pain is the most common cause of knee pain, patellofemoral pain, and simple remedies will get you through it quickly. I'd love to hear your experience with your knee injury. Leave it in the comments below. Please understand, though, that if you leave a question in the comments, I can't offer you medical advice. I might answer your question in a future video. Make sure to subscribe to my channel to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.